Obviously, one of the things that's very important to me is that our clinical treatment be appropriate for diverse cultural groups, that we think very carefully about, what we're doing and is it really universal, and, might some ways of working be a better fit for some clients than others, or even are there issues that we need to consider in working with clients of diverse backgrounds. I also think about not just cultural diversity, but also clients who are members of historically oppressed or stigmatized groups, so that it may not be ethnic or racial diversity, but people who might be looked down upon in society in some way, or might be excluded from different aspects of society in some way, where there's perhaps a lot of stereotypes or prejudice. So people in the LGBTQ community, people with physical disabilities. So the notion of exclusion and stigmatization, I think, are important to look at. And with depression, I think that those allowing people the space to talk about those kinds of experiences is very important as well.
Is there a way that you language it to invite them to explore that?
Right. So I often talk about very, very much experiences in the world, like, and how the world treats you. How do you think the world sees you? Those kinds of questions, so that people begin to be sensitized. And, later on, we may talk about that issue of the inner critic, but people begin to be sensitized to what they've internalized in terms of messages from, larger society about their value and their worth. And I think sometimes depression for members of historically oppressed and marginalized groups has some relationship to those issues of internalizing those negative stereotypes or those expectations that, well, you're not really capable, those sorts of things. So I think that that's important. I think it's also important to be very direct. So I'll ask people specifically, have you had experiences with discrimination or racism or heterosexism or homophobia or whatever the relevant issue is? It's very direct. And my experience is that people find relief when you put those things in the room very directly. You're saying, I'm open to talking about this. I'm not afraid of it. And, you can share those types of experiences here. So I think that those issues feel very important to me for therapists to consider, in addition to, sort of the typical things people might think about in terms of depression, but integrating, that we live in a world and what's happening in the world affects people. And that's an important issue to bring into therapy. It's not just internal, but that, interaction between the external world we live in and then what we do with that internally, and, how our internal experience then sometimes impacts what our experiences are in the external world, our ability to cope with racism. I think people who are depressed and have low self-esteem have an impaired ability to manage the discrimination and racism they might experience, and might have a tendency for self-blame. The issue with self-blame in terms of historically oppressed and marginalized groups is internalizing negative messages from society about one's value and worth. Messages that you may not be smart enough, or that there's something wrong with you. And so I think when people are depressed, they're more vulnerable to those internalized messages from how larger society is seeing us. So of course we know that people are vulnerable to, criticism from parents or, valued adults in their lives as children. And, we take in what others think of us in terms of beginning to form sense of self and identity and who I am in the world. And so when we're working with people who are, again, members of historically oppressed or marginalized groups, I think it gets wider, the things we need to consider about what people are internalizing. It's beyond sort of parents and school. It also becomes society.
So how do you talk about that or elicit that kind of exploration with a client?
Yeah. As I mentioned, I think that, I think it's important to be very direct, to ask, and use then once we, give permission for that topic to be in the room, then we use our therapeutic skills to explore and help people, kind of find their voice.
I guess the reason I asked it again is because I see this as different than asking, are you experiencing discrimination? In that sometimes we internalize judgments from the world and we don't even know that we've done that.
The idea that when someone is, feeling some sense of self-degradation or devaluing themselves, it's important to ask, where does that come from for you? Where do you think that started? To look for the source. Sometimes I'll even ask clients, whose voice is that? Right? Whose voice do you hear there? To help them identify whether it, again, is a close friend, family member's voice that they're hearing, a teacher's voice, or is it a voice that is from the media, or from politicians, or from wherever, that, just where have you gotten those messages from? Where is that voice? Is that your voice, or is that coming from somewhere else? So I think that, just digging and helping people begin to differentiate and discern, where some of that negative self-esteem or self-blame may come from. So I feel like those kinds of issues of understanding of how the world impacts the person, right? What does it mean to be an African American in the world? What does it mean to be a woman in the world? A gay man in the world? That those issues are not only identity, and identity is important to explore as well, but it's not only identity, it increases exposure to particular kinds of stress. Mm-hmm. And as therapists, we need to be aware of stress exposure. What are those kind of areas where people are experiencing stress? And related to that is then, what can we do to facilitate adaptive coping?